Good day, Internet. Ed here from Iridium Solutions. We're going to have a chat today, but first remember to hit that bell thing and that like and the subscribe stuff. Okay, do all that for me. If you find this video helpful, send it to at least one person. That really helps get the word out there. Today, we're going to talk about my medical bag. And this one is new, which is why it's so clean. For years, I was using the original Black Hawk Stomp, which stands for SEAL Team Operational Medical Pack bags for both my general trauma bag, so like my mass casualty bag, and the range bag. Now, I think I put the range bag on the internet before, showing some photos of the contents, but I decided I wanted something that was a little bit more low profile. These old Stomp bags I got for a great deal because they were in UCP, camo, universal camo pattern, which if you don't know what that is, it's the digital grays and whites that really stands out in the backseat of a truck or when you're walking around. So something a bit more modern and sleek, also a lot lighter. Those Stomp bags are rugged and robust and phenomenal. But for civilian life where you're not, jumping out of airplanes or doing any of that cool guy shit, it's extra weight. So that's why we've moved to this. I've gone through some of the contents, plus some stuff up, taken some stuff out because this is a smaller bag than the Stomp bags. So, I've come to what I think is a balanced approach to be able to deal with a lot of things. And I thought, hey, let's talk about it. Now, what's the bag? This is a Tasmanian Tiger Medic Assault Pack M.A.R.C.H.E. large. We do sell these on the website. I don't have any in stock. I have the mediums in stock, which are about one row of webbing shorter and a little bit skinnier, so they'll fit a little less stuff. But these generally are about 350 bucks. The medium-sized one are about $300. And they're a good bag. Tasmanian Tiger makes good kit. They're well known. So it's if that's where you choose to go, if you want to get a bag like this, then that'll be fine. Now, part of what I need to be able to do is, we're talking about civilian issues. Civilian problems and military problems are different. The age ranges, the body types are different, right? In the military, you're typically dealing with military age members, people in high physical fitness. And in a military setting, there's a lot of penetrating trauma, so gunshot wounds, and then blast, concussion, stuff like that. Vehicle rollovers also happen. And some of the things that we need to address in the civilian world don't really translate well to the military world. So having a bag that deals with more on the civilian side makes a lot of sense. So getting right into it. Right on the outside, first thing you'll notice here is I've got shears on the top. Those are going to be the main set of scissors that we've got for anything that we want to do. I have a tourniquet. This is an old Recon tourniquet. We can have the Recon tourniquet talk, but this one is mine. Okay, the company was a viable company up until not too long ago. I wouldn't go buy anything that looks like a Recon tourniquet now that the company's no longer there. I'll sell you, and you should buy a Cat Gen 7 or something equivalent. There's a tourniquet there. We're going to be able to address massive bleeding, so tourniquet a limb. Also, right on the outside, there's a little flashlight. This is a little Streamlight Micro Stream. I like a couple things about it. First of all, if I've got to set this thing up as easy access, it's a nice marker light. This takes a single AAA, and it can be just left on for several hours before it goes out. And it's really inexpensive to replace, as opposed to chem lights, which cost a couple dollars to replace each time you want to set one out. This can just be turned on as a marker light. Also, if you only need to have it out for 15 minutes, I can have this on for 15 minutes rather than having a chem light that's going to burn for 8 hours. It's effectively disposable. The other great thing that these little lights have is they've got the reverse clip. And so if I have to do some medical stuff sort of in the dark, this reverse clip can clip onto gloves, and you can have a light on your hands, and it can clip onto the brim of your hat. Show you like so, and once you do that, you effectively have a functional headlamp. Okay, so I like it because it does multiple things. EpiPen, that's an epinephrine auto-injector that delivers one 0.3 milligram dose of epinephrine, which is enough to start to reverse the effects of anaphylaxis. And then over here, that's a British Columbia Narcan kit. So that's a naloxone kit. It's got 3 doses of Narcan in it, and that's enough to start reversing opioid overdose. Okay, so right from the outside, before I even have to get into the bag, I can tourniquet a limb, I can cut clothes off so I can identify wounds, I can treat anaphylaxis, I can see what I'm doing, and I can treat an opioid overdose. Okay, so I don't even have to get into the bag to do those things. I like that flexibility. This zipper here opens up, and we have our little boo-boo kit. So if someone needs a Band-Aid, wound cleaned and a Band-Aid, I can do that without having to go into the main contents of the bag. If you're getting a Band-Aid from me, these are all Meditoon Band-Aids or Looney Tunes or Dora the Explorer. Kids Band-Aids. Because I buy my gear from the hospital places, and why would you have boring Band-Aids? The other thing that I have here is I've got 4 5x9 combine pads. The reason I have those there is for people who might have superficial injuries that aren't life-threatening, but that are freaking them out. And I can really quickly pull out probably the biggest gauze pad they've ever seen, which is a good sort of mental thing for them, and say, hey, take this, hold it on there. I know it's not life-threatening, but sometimes when a person's in a mental state that they're scared, they're seeing a lot of blood, maybe for the first time, being able to give them a big pad to just hold pressure on until that wound starts clotting can have a really good sort of mental effect, right? And so what I want for them to be is calm, so that we can then get the work done. And so if I can give them a big pad and say, yeah, you're right, that's a legit, you know, minor skin cut, boom, put that on there, or boom, put that on there. It's better than just giving them a small, like a 3x4 or a 4x4 gauze pad. It gives more confidence, right? And I get it. I mean, a regular gauze pad is probably fine. But what do I want? I want them to be calm. I want us to be able to work together, right? So I want their headspace to be in the right place. 5x9 ABD pads. This backpack also comes with a deployable high-vis marker panel. So there's an orange marker panel which you can rip out of here and put here in case you need to be found. So there's that. Okay, so that's the outside of the current medical setup bag, and then moving to the inside. Get these out of the way. So right from the get-go, we've already had 1 tourniquet, but if we need to, we've got another TQ right here. Okay. I've got another flashlight. This is a PowerTac M5. This one will go very bright, so if I need to illuminate large areas, it'll do it. I leave it staged on a pretty, you know, sort of low brightness setting, so that if it is in the dark and I do hit this thing, I'm not immediately blinded. It just gives me enough light, lets me find what I need really quickly. We have some compressed gauze. This was made by the Israelis. This is just compressed Kerlix gauze, pre-staged. Set of gloves, pre-staged. You're gonna see a theme with gloves in this bag. So there's gloves, and then a trauma bandage. This is from the Tactical Medic. We sell these. I like these. These are, they're great price. They do everything you need, nothing you don't. They're 4-inch pressure bandage. Okay, so that's, we're in massive hemorrhage, right? Or the M in the M.A.R.C.H.E algorithm. So we wanna control bleeding. So we've got a way to control limb bleeding. We've got a way to do pressure dressing. We've got wound packing. We've got a way to protect ourselves. And we have a way to see. Moving down, rolled gauze. Rolled gauze can be used for wound packing. Rolled gauze can be used for wound wrapping. Rolled gauze can be used for neck, head injuries. It's really very versatile. And yes, it's out of the package. It's not sterile. Not everything has been pulled out of the packages here. You'll see this one has it, and that's the only reason I've left anything in the package is either to protect the item if it's a wet item, or if letting it out would cause it to expand to a point I don't like. Otherwise, I want everything pre-staged outside of the packaging. That is because in a trauma situation, your casualty is already non-sterile for the most part, right? And they're already going to a hospital where we're gonna deal with any sort of infection that's getting in there. Plus, we've got another extra thing over here to help. So I don't want to waste the time. That means that this stuff, yes, it's non-sterile. So be it. It means I can employ it faster, and I like that. So I've got 4-inch by 4-yard rolls of gauze. I've got 2 ACE bandages. Now you might be thinking, Ed, why don't you have the really nice, the round pressure bandages, the Olays and all that. Fair enough. The real reason is because while those things are cool and they're in the TECC guidelines, people who do this job for a living don't always have access to an unlimited number of the tactical bandages. Like this, just ad nauseum, that's more of a military thing, okay? So in the civilian sector, your doctors, your paramedics are using ACE bandages and gauze rolls and regular Curlix. It's what they're using, it's what they have. If I buy my medical supplies in the same place they buy their medical supplies, okay? If the hospital medical supply places could sell me pallets of the sort of tactical pressure bandages, okay, I'd buy them. They don't, for a reason. It's a supply chain thing. When you come to class, with me anyways, I'm gonna teach you how to use ACE bandages and regular Curlix gauze. I'm gonna teach you how to use the high-speed pressure bandages stuff, but realize that this is that. That's it, okay? And so you need to be able to use this, which means you can use this, right? We need to be cross-trained to be able to do more things. Having these separated, because I've got the space to do it, gives me more options of how much and when I want to use these and where, okay? Whereas a combined pressure dressing may not always give me those options. So there's pros and cons, but that's what I've got here. And then a great big cohesive bandage. And a cohesive bandage can be wrapped around a limb to control bleeding, to support the limb. This can also be used to help getting my splints in place. Very, very useful to have a lot of cohesive bandage. This here is an H&H, I think they call it the Big Cinch bandage. Anyways, this is the big one. It's got an 8x10 pad in it, and this is the one for abdominal bleeders, okay? So if there's a abdominal laceration, part of the guts are hanging out, this is what I'm gonna use for that. So that takes care of most of our bleeding. You notice I didn't pull out any hemostatic gauze. I noticed that too. Let's circle back to that, but long story short, hemostatic gauze is great, right? But regular gauze does the same thing, only longer. If I have time to put hemostatic gauze in, I probably have time to put pack a wound with regular gauze. And if hemostatic gauze isn't successful, you have to remove all that hemostatic gauze from the wound that you just packed in order to put either more hemostatic or regular gauze into it, which can be problematic. And my regular Curlix gauze, I can use to wrap around a head if I've got an eye injury or anywhere else where you can't use hemostatic gauze because the hemostatics will interfere with the eye and dry it out. So hemostatics have a place. I don't say they don't. Get some, but don't think that they are the be-all end-all of gauze. They're part of the toolkit, that is all. In here, I don't have any because since, it's 2022. And the big problem with 2022 is everybody wants to fight each other, and the various hot conflicts that are going on around the world have called for most of the supplies for hemostatic gauze. And so all the hemostatics that we have are currently allocated either to kits that have gone overseas or available for sale. There's not a lot left over. I don't think I need it in this kit. If the supply chain changes, when the supply chain changes, for the better, hemostatics can go back in, but I don't lose sleep over it, okay? All the old Special Forces medics, by the way, they didn't use hemostatic gauze, they didn't have it. They used plain Curlix or plain Curlix and ACE bandages, and it worked for them. So, these panels all removed from this backpack, which is kind of cool. So I'm gonna pull up this next module. We've covered M in March, which is massive hemorrhage, okay? The next one is gonna be airway. And typically speaking, in a civilian setting, you're going to deal with airway by doing a head tilt chin lift, okay? So that you can open their airway, by putting your casualty into the recovery position and or insertion of a nasopharyngeal airway. And a nasopharyngeal airway goes in through the nostril and then back and down, okay? And then sort of bypasses the tongue so that you have a patent airway even if the tongue slips back. Quick note on nasopharyngeal airways. We want to avoid them going in and up. So we're going to pick a nostril, we're going to push the nose back And then with the casualty laying on their back or even in a chair, you're gonna make sure you push through. If they're laying in a chair, you're gonna push through towards the wall and down. If they're on the floor, you're gonna push down towards the floor and then down towards their throat, rather than up towards their brain. In all of recorded medical history, there have only been, there's only data for 4 incidents of all the MPAs that have ever been put in. Only 4 times have they ever gone up into someone's brain, but you don't want to be the 5th time, so do those things. So we're gonna do that. We've got a little emergency one-way valve in case you need to give rescue breaths, all right? And that's basically all a bystander is gonna do for airway, okay? So we're gonna head tilt chin lift, we're gonna do recovery position, and if we need to, we're gonna do nasopharyngeal airway. I like NPAs for moving an unconscious casualty that needs to be in a litter or strapped down, because if they're unconscious, they may not have control of their tongue. And if you have them strapped down, maybe you can be watching them to see if their tongue starts to occlude their airway. Maybe you can't. If I put an NPA in, I can strap them down, know that they're gonna have a patent airway, and then extract them, move them to a higher level of care without having to worry as much that they might die en route. NPAs. Back up in here, there's lube, lubrication for the NPAs. Use a water-based lube if you can. If you can't, saliva. That's it. So if saliva is your baseline that you can use, then you know that we're not too worried about it. It just has to get in. The more lubricated it is, the easier. I've got 2 different sizes. I've got 28 FR. FR stands for French, and that's the most common size. And then I've got 26 FR. Either of those sizes is fully appropriate for adults. When you get down to really small children, that might be a problem. When you're going to put your NPA, you want to have a good look up the nostrils. People get broken noses. People might have other issues going on inside their nostrils that might cause one nostril to be mostly occluded and the other one to be more open. Choose the larger opening. Right? Nasopharyngeal and rescue breaths. Over here, this is something you might want to practice or look into. This is all the stuff you'd need for an emergency cricothyrotomy. So that's a tracheotomy. That's where we're going to cut in here. That's where we're going to take a little tube. We're going to insert it up in there and bypass any problem that's going on in the face. I didn't mention this with the MPAs. If you've got a casualty that's got maxillofacial damage, so anywhere up in here, if they're damaged, you can't put an NPA in there. The reason is because we're afraid it's going to go up in the brain. In that case, that's when you start to think about a surgical airway, which means cutting here, not as a bystander. The Good Samaritan laws that we operate under cover everything other than putting new holes or cutting into our casualties. So if we can't cut into them, we can't stick needles into them. If we do that, we're outside of the boundaries of Good Samaritan acts, okay? So know that. That being said, this is my tracheotomy kit. It's all condensed down, all separated out. There's endotracheal tubes. There's all the stuff that I would need in there. This is a easy scrub. This is a chlorhexidine gluconate pad, so CHG 4% pad. So this is the hospital grade preoperative scrubs. So if we are going to go ahead and need to cut into somebody and we have the time, then we might want to go ahead and clean that area off before we introduce any of the bacteria that's on the outside of their neck to the inside of their neck. So that's what that's about. That's airway. You guys having fun? All right. Massive bleeding, airway, respiration. Under TECC for civilians, basically respiration, and we're talking about being able to breathe, so the lungs, we manage that with chest seals. That's effectively it, okay? So what we've got here, now, if you've watched the internet or you've done medicine, you know that needle decompression is a thing. I don't disagree. It's a paramedic level skill. We've also just talked about the fact that it's not covered under the Good Samaritan Act. Okay, needle decompression, if you don't know, is if you have a hole somewhere in your chest, there's a pleural space inside there which surrounds your lungs. And so that pleural space gets bigger and smaller as the lungs expand and contract. If there's a hole in your chest, then air can go in as you're breathing and get stuck in there, causing pressure to build up on one or both sides, squeezing those lungs shut. effectively making it so you can't use them. What you need to do is create another air passage to allow that pressurized air to escape. Needle decompression is when we stick a 14 or 10 gauge needle, 3 1/4 inches long, in either, generally speaking, up here or here. Or, because we have 2 lungs, up here or here. That's as far as I'll go into it, but know that it's a thing. You can look that up on the internet. Skinny Medic has good videos on it. Go check his channel out. You're good to go. Right in here, I've got more gloves, because if it's just a chest injury thing, I'm just gonna grab this for my airway stuff and then go. So gloves, if I wanna put chest seals on, there's probably some blood or other items. So I've got gauze pads to wipe off and BZK wipes to clean that off. Chest seals. These are SAM chest seals. There are 2 of them in each pack. So that's 2 chest seals. I have my 14 gauge angio catheters taped to it. Yes, these are not these North American Rescue or TECC really high speed ARS needle decompression needles. They are regular hospital grade angio catheters. They're the same thing. Effectively, they're the same thing. That's what's going to be on board most ambulance services and inside most hospitals. This is what's used. So I've got 1, 2, so we can do either 1 person front and back, or 1 person side and side, and then another one. So we can do, effectively 2 people, or if a person's taken like a big round of big shot of buckshot, right, and it's gone into both lungs, maybe we need to cover both. Flexibility. And that's what we're gonna do. That's what we've got. I've got 4 needles for needle decompression. If it doesn't work up here, you might choose to go down here, or you might choose to go right beside it and try another one. One thing that's important to note when we're talking about needle decompression, because we're talking about it, even though I'm not going to show you, is if you choose the site on the top of the chest, it's been reported that it's more comfortable for patients. But if you have a patient where that's the problem, but you're afraid you might have to start doing CPR on them, CPR requires you to crush your chest in like this, right? So you could come into a place where you're compromising this needle decompression if you have to do CPR on them. So in that instance, you might choose to go in from the side. There's other reasons, but that's a good little tip there. So there we go. We've got respiration. I have more gloves here because if you have a helper to help you, you might want to equip them with some gloves too. Okay. Massive breathing. Airway, respiration, circulation. Circulation is actually up in here, but for most of us, we're gonna manage circulation, which is blood in the body. We're gonna manage it by keeping as much blood in the body as possible, which means assertively, not aggressively, but assertively tourniqueting limbs where there's massive bleeding coming out as fast as possible. The more blood that's in their body, the higher their chances of survival. That is a proven medical fact. The more blood you can keep in their body, the higher their chances of making it out alive. Okay, so circulation, that's how we're gonna deal with it. But because I'm me, I have some other stuff. So, this is a turkey baster. This is the medical version of a turkey baster. And I can use this to this is just aside from circulation. This can be used to remove something stuck in a throat. This can be used to either suck away wounds so I can see inside them, or filled up with water or saline to irrigate wounds. It's for pre-cleaning. When it comes to doing IV, intravenous access, we have one of our, back up in here, we've got an IV start kit, and then we've got saline locks. I'll show you. So we've got some saline ampules, we've got our IV start kit, which I've done a video on this before, and then in this one, I'm not bringing saline, but I am bringing dextrose. So if we have low blood sugar, I've got a little bag of dextrose. The reason I do this rather than the oral sugar is oral sugar makes people throw up, and it makes people's stomach sick. It's just super sweet. And the last thing I want to do is with everything else going wrong, then induce emesis or vomiting. It's just an extra complication. Okay, so that's what we've got for that. A little aside, I've got a little bit of lidocaine and some way to administer it. If I need to start doing surgical stuff, a little subcutaneous lidocaine to numb the area can be useful. That also applies in gums, okay, in teeth, but that's not something that I would recommend that you just sort of pack around without training. So if you're gonna do bottles of liquids like this and things that stick into people like this, then you require further training. You need to get that. Okay, so basically, circulation, I just want to keep the blood in the body. Like, I want to do it beforehand. Once you get paramedics on site, they have a lot more freedom and range of capabilities when it comes to putting IV fluids or packed red blood cells or whole blood or whatever the casualty needs back into that casualty, stabilizing them, and then taking them to the higher level of care. Okay, so circulation we cover later. And then there's head injury, hypothermia, and everything else. And let's do, yeah, we have this open, so we'll do hypothermia. Hypothermia goes along with shock and goes along with massive blood loss. And just about anybody who's lost a lot of blood is hypothermic. Okay. In fact, you should just blanket state that if a person has a massive hemorrhage, they're hypothermic. We're going to treat them as such because it improves their chances of survival to treat them as such, and it doesn't reduce their chances of survival to treat them as such. But if we don't treat them as such, it reduces their chances of survival. So we want to be able to, where's my stuff? Here we go. We want to manage the heat in the room. I'm making a nice pile on the table. I know, I figure it looks cool. So survival blankets, these are survive outside longer heat sheets. These are a little bit better than the sort of Mylar blankets because they wrap around and we can sort of make a taco out of them. And if we're dealing with hypothermia, we may also want to be able to deal with hyperthermia, which is being too hot. So instant cold pack, take care of that. Okay, so we heat and cooling. Know that when we've got a hypothermic patient, we can't just wrap them up and consider it good. We also need to consider finding ways to actively warm them, okay? So things in your environment that might do. Now, in the bag you set up, you might choose to bring hot hands like grabber hand warmers or something, so you can throw those into a hypothermic patient's bag that they've got. That's a good start, right? So that's hypothermia. I've got also a thermometer so that we can monitor the casualty's temperature. Because you can assume all you want, but a little bit of data goes a long ways to helping you plan and execute. Okay, we'll do burns now. So burns sort of fall into the everything else category, but also if you've got a casualty that's got burns to large portions of their body, the skin, the organ that's burned, is not going to be able to transfer heat in and out. And typically speaking, lots of burn patients arrive to the hospital hypothermic. And so, treat burn patients as if they're hypothermic, even though they might say their skin is burning. They're not being able to regulate the body temperature inside their body, and so we need to do that for them outside the body. And secondly, let's see if we can find a way to dress the burn. So I've got some ways to dress burns. So we've got 4x4 sterile gel soap burn dressings. These are Burn Stop 100s. And then petrolatum, which is effectively Vaseline impregnated gauze pads. So these can go directly on the burn. Depending on what kind of burn it is, you might want some dry sterile dressing. So I have dry sterile cravats. Okay, so basically these are triangle bandages. That'll do that job. Now, we like things that do multiple things. A triangle bandage is also an improvised tourniquet. Remember, start with a real tourniquet because they're faster to get on. But if you need to, you can take this out. You can turn it into a line. You can wrap it around your leg, tie a knot. Take a windlass or something strong that is otherwise pre-staged. I like scissors or forceps or something with handles because I can tie this around. I can spin this as my windlass. Once I get enough pressure that the bleeding is stopped, I can take the free end of the bandage, wrap it through this hole here, and then tie it off, and then it holds itself in place. Okay, so I don't have to use 2 of them to then wrap it around to hold this windlass in place. So that's those are emergency tourniquets. That's 2 more, but they're also dry, sterile dressings to use for burns. Okay, so that's how we're dealing with burns, how we're dealing with hypothermia, how we are dealing with circulation, how we're dealing with respiration. We have, in this sort of basic surgery spot, these are 10 milliliter saline flushes. So these can be used for irrigating wounds. They can be used for, if you're doing IV starts, for flushing your lines with saline. So they're pretty useful for that. Tape. This is surgical tape. These are duct tape cards, because I have no intention of running out of tape while I'm trying to fix people. Tape is very useful. I'm not going to run out of it. This is one of our Iridium Solutions suture modules. So it's got all the things to do sutures. I'm going to do a separate video on exactly all the contents that are in here. Just know that it will, help you stitch people up. This is not something that we should need if we can call an ambulance. If we can call an ambulance, don't worry about getting your suturing kit out and trying to stitch them up. In fact, everything that you're going to do, short of this tourniquet to a casualty, where you can call an ambulance, okay, when the paramedics get there, maybe the paramedics, certainly at the hospital, everything you've done is getting cut off, okay, so they can go in and fix the casualty. So this is for like sustainment. If we're a day or 2 away from help, and also remember all these things, all your cool guy stuff that you can put on there, that paramedic may walk on scene and be like, "Oh, that's awesome," cut it all off and then redo it themselves. Remember that. Be okay with it. Your job is to get them to the point where a higher level of care comes. If we've done that, it's a success. All right, more saline. We have eye shields. Okay, there's 2 eye shields in here. You may need to put 1 eye shield over an eye and then wrap it around the other eye. You might need to make your casualty blind. You may not need to blind them, depending on what the thing is. So this may work as 2 eye shields for 1 casualty, or 1 eye shield for 2 casualties, depending on the type of injuries. If it's dust and debris, and it's just, you're able to wipe it out, but the eye is, otherwise inflamed, you don't have to worry about making them blind. You might just want to protect the eye and then still have them be able to see. If they can see, they can move. If you put shields over both eyes because you're worried about, both eyes tracking together, then you also have effectively made your casualty blind, and that means that you have to stay with them. You've decided, I've got to stay, or somebody has to stay with this person until they get to care. Okay, so that's a consideration. We have eye shields there. These are combat wound pill packs. You will look these up on the internet to find out what is all in them. Basically, you look at the TECC guidelines, because it's the military that came up with this idea. This is point of injury antibiotics, to get antibiotics into the bloodstream of the casualty as soon as possible. Remember, I said it's already non-sterile once whatever is penetrated into their body, right? So we're already non-sterile. We don't have to worry about that. But what we are going to do to plus them up is get some good broad spectrum antibiotics going. The medical data says that the faster you get antibiotics into them, the better their recovery and the less chance of downstream infection problems. Okay, so we're going to get some of these antibiotics and pain management into them. You're going to have to choose a type of pain management that doesn't interfere with their blood's ability to clot. Okay, ibuprofen and aspirin really aren't useful because they interfere with your blood's ability to clot. And what do we want? We want their bleeding to stop as fast as possible. We want their clotting to happen as quickly as possible. We don't want to interfere with that. So we'll say about that. This is an Adventure Medical Kits, dental medic. So there's a small amount of medical supplies in here that we can deal with if someone's got a broken tooth, if someone's got a filling that fell out. Okay, and that sort of goes part and parcel with lidocaine to be able to. So we can address a little bit of teeth problems also. Cool. I mean, we're very much into the E in the M.A.R.C.H.E algorithm, the everything else, and so I'm just going to show you the sort of supporting things. We'll do this. We've got splints. Okay, so a pair of SAM splints. We talked earlier about we can SAM splint up a limb, and then we have a cohesive bandage to wrap around it to support those, so we're good to go. This is a blood transfusion kit. That is what that is, in case you should have to. That's, again, the skill level required to do that, and the responsibility that you're taking on, should you use that, is something you have to consider before you go ahead and acquire, train with, practice with, and then potentially employ, okay? Back up in here, we've got chem lights. So if I need to be able to put markers out, I've got red and I've got blue. That has to do with some of the agency work, partner agencies that we've worked with. This is some of the colors they use to say things in a visual manner that they may not want to have said audibly. So if we have to be quiet, there's a way I can mark it. Obviously I still have my flashlight, that gives me more versatility. So layers of versatility there. Up in this side, we've got a Foley catheter and a chest tube, right? So that's for doing chest tube stuff. Again, that's paramedic and doctor type stuff. Foley catheter helps with doing the neck stuff and sometimes doing the chest stuff. Okay, let you learn more about that on your own. Google, well, whatever your preferred search engine is your friend. So then up in the last sort of everything else pouch, this is the catch-all, right? This is where we keep extra band-aids, gauze pads, the small gauze pads, and then some of the individual medicines, right? So thinking if someone's got nausea, if they've got just, menstrual cramping, other sort of general pains that aren't trauma related, heartburn, diarrhea, we did nausea. Okay, so it's all that stuff. There's some Soothisting swabs, so if someone's got a bug bite or whatever, you can be able to numb that area. There's minor wound closure type stuff, a little Tegaderm dressing, some minor burn gel. So if you need to just, like a small burn, like someone gets a burn on their finger, you don't want to go ahead and use your big burn dressing, we just apply a little burn gel to that. So that's what's in this bag. More gloves in case, this is the one I take out. Gloves, I have gloves everywhere, and they're small, they're easy to pack, and you need them. And if you're doing multiple things to a person or a thing to multiple people, you find yourself taking gloves off really fast and putting them back on. If you are all of a sudden you find yourself in a sort of CBRN environment where you have toxic industrial chemicals or chemical warfare agents, it's been demonstrated that multiple pairs of nitrile gloves layered over each other will confer more than a few seconds of protection. So if I have size large and size extra large, I put the larges on, the extra larges over top. If I have to deal with a casualty that's been exposed to a CBRN agent, I'm giving myself extra layers of protection. So extra gloves, okay? More Kerlix gauze. This is a compressed Kerlix gauze. This is 2 gauze rolls, which I have vacuum sealed and shrunk down. So those 2 plus the other one makes 3. And then we have our gauze pack that we sell. So that's our gauze module. It's got, 3x4s, 4x4s, 2x2s. More gauze rolls, more petrolatum. So we could do gauze thing, thin tape, and then a little bottle of betadine. So if I need to clean a large area and I don't want to use a debriding brush because the scrub brush is going to go ahead and debride. If I just want to do a little spray, then I've got that in the form of a bottle. That's it. That's the whole contents. They fill up a table, but you saw how when they're packed in there, they all get packed really easily. I didn't show this bleeding panel, but this thing also pops off and you can throw it to someone and say, hey, go deal with these problems. When you're triaging wounds, we want to make sure we deal with the top priority first. That's why we have massive hemorrhage gets the most action in play. We want to deal with that first and then move on to everything else. That's the thing that's going to kill people the fastest. I don't have any more points or tips to add. I went a little longer than I thought I was going to. Originally, I was just going to be showing you stuff, but what's the point of just showing off things without explaining the why behind them, right? So that's what we got. Questions, comments, concerns down below. Thanks for watching. Tune in to the next one. More great content coming.